talk about Professor Helen Stokes-Lampard. She was nominated by Dr. Anne Connolly. You can read the full citation on our website, but here is a short overview of why Anne said Helen deserves the honorary fellowship. Congratulations on being awarded the honorary fellowship of our faculty. Thank you so much for joining me today. Helen, you and I started our presidential terms together, didn't we? And we've had a great, great run together. So it gives me such pleasure really to be able to award you this fellowship and interview here today. Let me start by asking you, what brought you into medicine and into women's health?
Firstly, Asha, let me say the most enormous thank you to you personally and to the faculty for this award. I'm truly thrilled and honoured. I've always had an interest in women's health, and my primary clinical interest was always in gynecological cancers, and that's what I fully intended to do. But if I go back to my childhood, I was brought up in a former mining community in South Wales. I went to a pretty tough, comprehensive school, but I had the sort of background where nobody ever told me that girls didn't do medicine. In fact, I was encouraged to be the best I could be. And it was much later in my professional development where I realized that there were barriers that some women face. But by then I was already in medical school. And I started my professional career in gynecological cancer screening. I later changed to general practice and academic general practice, which has been a huge source of joy and pleasure. But I've always retained that interest in women's health, sort of every aspect of women's health. It was a natural fit for me, both my research interests and then later as I sort of had political interest, that I could do my bit to help advance the cause for women's health, whatever aspect of it that might be.
Fantastic. And how you've done such a great job with that. We are really, really lucky with your interest. One of the things, Helen, you always have said to me is that there is no glass ceiling. And really, what would be your advice to other women who want to be leaders in women's health? What would be your advice to them?
So look, of course, there are some glass ceilings that remain, but I think the glass ceiling with respect to gender has been smashed many times already. There are so many that have gone before both of us who've done amazing things in that regard. So we have great role models that we can follow. I do think that women sometimes need a gentle encouragement, sometimes a gentle push to put themselves forward for things. We know there's lots of research showing that women are reticent to put themselves forward for opportunities and jobs because they fear they don't tick every box on the list, whereas perhaps others are more keen to put themselves forward when they clearly don't hit the job description. So there's something about peer support, women supporting women. There's something about us giving ourselves the courage and the confidence to step forward. And I think for me, giving myself permission to try something, knowing that I might not succeed, has been a big step forward in my personal professional journey. So permission to fail and learning how to get over disappointment and failure is so important. As high achieving healthcare professionals, which doctors all are, actually we don't have as much failure to deal with and learn to cope with as some other people do. And some people are really frightened of failing when they get later in their careers. If you can get over that or help others get over it, it's incredibly liberating. And then many of the barriers that we perceive just fizzle away. I mean, they do dissolve away. So for me, it's helping one another, getting that permission to fail, but also having mentorship and support, networking for one another. I really think we all have to be both helping people give a step up, but also with our friends and colleagues, giving them the gentle shove forward that sometimes they need.
That's such an interesting perspective you put forward around sort of allowing yourself to fail, isn't it? I find that fascinating. So really, thank you for that unusual perspective.
Thank you.
I'd also like to ask you, what are your plans, future plans, particularly around women's health?
Well, I'm really blessed at the moment as chair of the Academy of all the Medical Royal Colleges. The work I'm doing touches all areas of medicine, and it's been a huge learning experience for me, but also very empowering. My personal passion is about levelling up and how we best reduce health inequalities. I think possibly coming from the background I did, seeing the challenges of poverty and deprivation and health inequalities layered onto the already existing social determinants of health. And I've become involved with the social prescribing movement, and which is basically enabling people to live their best life in all the areas which are outside the NHS. So it's that totality of health and well-being. So whilst I'm pretty busy the next couple of years, I think in the longer term, I'm sure that whatever I do will be to help that sort of inequalities and levelling up agenda. That's really what gets me out of bed in the morning. I remain a frontline clinical general practitioner as well. And I have to say that frontline general practice, that face-to-face contact really keeps me going. It's incredibly inspiring at times, and I feel blessed to be part of the most amazing healthcare system in the world in our NHS. So I don't know what the future holds, but I'm up for it.
Fantastic. So thank you very much. It was
Thank
brilliant, learning about what drives you and what your plans are. And I'm sure our members will find that fascinating.
Oh, bless you. Thank you all so much. It's a real privilege and honour.
And it is for us too, because you've done so much for women's health. Congratulations again, Helen.